Your body is making sounds right now. Your heart is beating. Your stomach is digesting. Your joints are moving. Your breath is flowing in and out. Most of these sounds are normal, expected, unremarkable. But some sounds that many seniors hear regularly and dismiss without thinking, are signals, quiet communications from inside the body that something deserves attention. Today we are going to go through the sounds your body makes that are worth listening to, the ones that are harmless, and the ones that are not. This video is unlike almost anything we have done before because it requires you to pay attention to something you have probably been ignoring for years. Stay until the end, because the last sound on this list is the one most seniors dismiss most readily, and it is the one that most consistently signals something worth a doctor's conversation. Sound 1. Your joints cracking and popping. Most joint cracking and popping is completely harmless. The sounds come from several sources. Gas bubbles forming and collapsing in the fluid surrounding the joint. Tendons and ligaments snapping over bony prominences as the joint moves. Rough joint surfaces moving against each other when cartilage has thinned. The cracking of knuckles. The clicking of knees going upstairs. The popping of shoulders when reaching overhead. In most cases, these are sounds only. They do not indicate damage. They do not predict arthritis. They do not mean anything needs to be done. The exception: pain with the sound. If a click or pop is accompanied by pain, swelling, or a sensation of catching or locking, the sound is now a symptom. That combination warrants assessment. A joint that grinds rather than clicks, a deep, rough, sandpaper sound of bone moving against bone, can indicate significant cartilage loss. If you hear grinding from a joint and it is progressively worsening, this is worth mentioning to your doctor. Sound 2, ringing, buzzing, or hissing in your ears. This is called tinnitus. It affects a very significant proportion of adults over 60. The sound is generated inside the auditory system itself, not from an external source. It can be constant or intermittent, one ear or both. High-pitched ringing, low humming, buzzing, hissing, or pulsing. Most tinnitus in seniors is caused by age-related hearing loss. The auditory system compensates for reduced input by becoming more internally active and generating its own noise. Other causes include earwax buildup, certain medications, particularly some antibiotics, anti-inflammatories, and quinine-based medicines, blood pressure changes, and neck or jaw problems. One specific type of tinnitus deserves immediate attention: pulsatile tinnitus, a rhythmic sound that pulses in time with your heartbeat. This type can indicate increased blood pressure in the vessels near the ear, arterial narrowing, or occasionally a vascular abnormality. If you hear a pulsing or whooshing sound that seems to beat with your heart, mention this to your doctor urgently. Sound 3, your stomach growling. Stomach growling, the medical term is borborygmi, is the sound of gas and fluid being moved through the intestines by the muscular contractions that keep digestion moving. Normal growling at normal intervals is completely harmless. It is simply digestion being audible. When it becomes worth noticing, high-pitched, frequent, very loud bowel sounds, particularly if accompanied by cramping, bloating, or diarrhea, can indicate that the bowel is working harder than normal. Possible causes include food intolerance, infection, or in more concerning cases, a partial obstruction. The absence of bowel sounds, if your abdomen seems unusually quiet for many hours, particularly alongside pain or vomiting, is also significant. The bowel should always be making some noise. Silence suggests it has stopped moving, and this is a medical emergency. Sound 4, a whistling or wheezing when you breathe. Normal breathing is silent. You should not be able to hear your own breathing during ordinary rest or gentle activity. An audible wheeze, a high-pitched whistling sound when breathing out, indicates that air is being forced through narrowed airways. In seniors, this can indicate asthma, chronic obstructive pulmonary disease, or fluid in the lungs. If you have developed a new wheeze, particularly if it appears on exertion lying flat or at night, this needs medical assessment. A different sound. Stridor, a harsh, high-pitched sound on breathing in rather than out, is more concerning and more urgent. Stridor indicates significant narrowing of the upper airway. If you or someone near you develops stridor, seek medical attention immediately. Sound 5, a whooshing sound in your neck. This is the last sound, the one most readily dismissed, and one of the most important on this list. Some people notice a whooshing or rushing sound in their neck, sometimes only when they press on the neck, sometimes spontaneously. This sound can indicate turbulent blood flow through the carotid artery in the neck, the artery that supplies blood to the brain. Turbulent flow in the carotid artery can be caused by arterial narrowing due to plaque buildup. A carotid artery with significant narrowing produces a characteristic sound called a bruit. which doctors can hear through a stethoscope placed on the neck. Significant carotid artery narrowing is a risk factor for stroke. It is detectable, and it is treatable. If you have ever noticed any unusual sound in your neck, particularly a whooshing or rushing quality, mention this to your doctor at your next appointment. Ask them to listen with a stethoscope to both sides of your neck. This takes 30 seconds, and it can detect something that significantly changes your cardiovascular risk assessment.